Well, this is the first time Heart of Australia is bringing radiology services out to people out in regional areas on the back of a truck. So in that clinic you see behind me, we have an X-ray machine, a CT scanner, and it doesn't have to go park in a hospital. It can park in a mine site, in a cane field. So bringing these sort of vital radiology services, which we rely so much on in medicine, which are now as commonplace as antibiotics, out to people in these areas where previously they would have had to have travelled a long way to access these services. What you're seeing is the world's first battery-operated CT scanner. And what that means is we don't have to be parked somewhere where we can plug it in. It can literally go somewhere, park anywhere, whether that be in a mine site, a cane field, and you can walk up those stairs and get a CT scan done. It's very exciting and really the essence of what mobile health services is all about. These sort of services make healthcare so much more accessible for regional Australians. And if we can find things earlier, if we can treat things earlier, we will eventually keep people healthier and help them live a longer life. That in itself is just an amazing thing to be able to offer to country people.
iMed Radiology is the radiology partner for Heart of Australia, and we provide the radiology services as part of this service. That includes providing the radiographer within the truck to acquire the images on the patient, and it also means that we take care of all the data transfer and the reporting by the radiologist. If you don't have access to high-end specialist equipment, you don't even have the access to the rest of the process. So it's really important for people in the outback to be able to access this sort of service, not just the equipment, but the full back end of the process. Otherwise, they don't have the same opportunities for improved health outcomes as everyone else does. And what we know is that we've already identified some stages of disease in patients who were unaware that they had an underlying pathology. This includes patients with very likely early changes of dust-related pneumoconiosis, but also emphysema, and I think also a couple of cases of likely lung cancer. These patients will now be able to access specialist healthcare for these diseases sooner with an improved patient outcome. Oh, it's an amazing result, and it's really just a sign of things to come, because on the small number of people that we've already been able to screen, we've had really promising and really encouraging results, and we know that this is going to be replicated over the years to come. So iMed Radiology is the largest provider of regional radiology services in Australia. This partnership opportunity with Heart of Australia was a wonderful opportunity for us to cement this further. We are delighted to be able to bring our services and our expertise to the regional parts of Queensland.
Yeah, so obviously to get the system in a position to be able to manage that vibration scenario, we had obviously worked with Rolf and his team to understand what that might look like. The factory then did simulations on the base of sort of past information that Rolf had from his previous trucks as well. And then based on that, we had to make certain modifications in the system in order to be able to handle some of those vibrations. And then obviously the way the system is mounted is quite different to potentially how it would be in a fixed environment. So we had to make some modifications around that as well. I think it's huge, because obviously we take it for granted if we live in a big city that we can just go around the corner to the local hospital and have access to equipment of this level. Now, to be able to put it into a mobile environment and be able to take it to the patient rather than the other way around, I think is huge. And we've, with our involvement with Dr. Gomes now for the last 4 years plus minus, we've seen what he's done and how he takes that to the regions. And this just was for us a logical next step in terms of augmenting his service, adding some value to it, and then being able to take technology of this level out to the patients. The fact that we can bring technology like this to a group of people that potentially might not have had access to this, or might have had access to it but maybe too late, or maybe not at the right time when they should have had it, that's just awesome.